86% of organizations value professionals that upskill to advance their careers. It's never too late. Enroll for a self-paced online course to begin upskilling in monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal and infant young child nutrition. Apply today to enjoy a 10% discount.
Hello once again, everyone, and welcome to today's webinar. Today's webinar, as I did mention, is on social and behavior change communication. And this is a free webinar to all. And the topic for the day is effective communication strategies for successful SBCC campaigns in the humanitarian context. Our key speaker for the day is Susan, who's a WASH specialist, that is a water, sanitation and hygiene specialist, as well as an SBCC specialist, social and behavior change communication specialist. And she'll be taking us through today's topic, effective communication strategies for successful SBCC campaigns in the humanitarian context. Before we begin, I'd like to start with some salutations. However, even before we get to the salutation bit, I would like to start by mentioning a few house rules. So house rule number one is engage us in the chat section. We are very active in the chat section. You know, I already see a number of us who sent in their salutation. I do see James, I do see Unyin, I do see Amid, I see Sugath, I see so many people, Simon, thank you, Jafar, thank you so much. I see you've let us know where you're joining us from. So do engage us in the chat section quite a lot. And even if you're interested in any of the courses that we will be discussing today, I encourage you, you can share your contact details with us in the chat section. That is your email address, as well as your phone number and your name, and our team will be able to reach out to you with more information regarding the courses, as well as assisting you in terms of registration for these courses. So in the chat section, that is what I've mentioned, engage us. Let us know if, in case you're even facing any challenges in terms of sound, audio, visibility, kindly let us know, we'll be able to assist you. House rule number two is engage us in the Q&A section, the question and answer section. There's a little bit there next to the chat where you're able to see Q&A. So throughout our experts presentation on effective communication strategies for successful SBCC campaigns in the humanitarian context, you might need to ask a question, or you might come across something that you really don't understand. Kindly put your questions in the Q&A section, and at the end of her presentation, she'll be able to take up the questions and answer them. House rule number three is there's a section that allows you to raise your hand. Kindly participants wait until the end of Susan's presentation, where there will be, like I did mention, the Q&A session, where we will ask a couple of participants to come on board and ask questions live during the webinar. At this point, we'll request that you raise your hand and we will allow you to speak. In case if you're facing any challenges or any difficulties throughout the webinar, it's easier for you to engage us, like I did mention, in the chat section. We'll address that quicker, as opposed to you raising up your hand where we might not see it until the end of Susan's presentation. So those are the three house rules for the day. I kindly request that we adhere to all of them in order for us to have quite a good experience throughout this webinar. With that said, I'd like to welcome the Humanitarian Global Team to just say hello. actually, they're all quite engaged, responding to your chat sections. So at this point, I'll just acknowledge them. We do have Ian, we do have Brian, we do have Sheila, as well as Anthony, who are working very hard behind the scenes to enable us to be able to experience this webinar. It's also been live streamed on Facebook, so thank you so much for that as well. I'd like to just bring on Susan to say hello before we proceed. She'll be able to come on later and talk about effective communication strategies for successful SBCC campaigns in the humanitarian context. Susan, you can just say hello to everyone.
Hello, everyone. I hope you're all doing well from where you're joining us from, and I'm glad that you've been able to join. I look forward to a very interactive session. And karibu in Swahili, that is welcome. Thank you very much.
Thank you so much, Susan, for that. So before we even proceed, I'd like to just mention, I did mention we have a number of new trainings, upcoming trainings. I just want to mention them a little bit before we proceed, before we are able to proceed with today's topic. So allow me to share my screen. So I believe we can all see my screen. So we do have 8 new upcoming trainings, and these are both on-site and online trainings. We have one that is on WASH. We have one upcoming one, SBCC. We have a lot when it comes to data collection, data analysis, data visualization, and this includes data collection for humanitarians using COBOL Toolbox and Open Data Kit, that is ODK. We have one on MIL, Monitoring, Evaluation, Accountability, and Learning Training Workshop. We have, like I did mention, a lot on data collection, analysis, visualization, including one where we use SPSS and Power BI. We have fundraising and resource mobilization for NGOs training workshop. We also have writing proposals and reports for donor-funded projects. We have leadership and project management for NGOs and development training workshop. So today I'm just going to touch a little bit on 2 of these, which is the WASH, Water Sanitation and Hygiene in Humanitarian and Development Context Training Workshop. Like I did mention, this is happening on-site and online. So on-site, it starts on the 16th of this month, 16th of October, for 5 days to the 27th of October. And the online one starts from the 27th of November to the 1st of December. Remember, here at Humanitarian Global, we like to keep our training numbers very little so that we can be able to pay attention to each one of your needs and ensure that the skills we're trying to impact on you are actually transferred. So when it comes to WASH, some of the objectives that you can expect is understanding the concepts of WASH, and this is a comprehensive, the keyword here is comprehensive understanding of key concepts of WASH, understanding how you influence hygiene in our everyday to-day lives, and not just ourselves, but the communities around us as well. The kind of tools that you do use in water quality testing, as well as how to go about water quality testing, and successful implementation of WASH projects. So you're going to have a look at a lot of case studies when it comes to WASH projects. You're going to be able, like I did mention, it takes 5 days for the physical training and then 10 days for the online training. And you're going to be able to cover a lot when it comes to the WASH program. And some of the things you can be able to cover includes WASH financing. So everything when it comes to WASH, including WASH financing and WASH budgeting, because I know I had not mentioned those in the objectives. Something else you're going to be learning about is how to access water, including borehole drilling. I did mention something on hygiene promotion, and something else I did mention a very comprehensive understanding of WASH components. As you can see, it will be the first session, the introduction, where you're able to understand all these concepts. Remember, here at Humanitarian Global, we have a very progressive way of learning where we start with the introduction, the basics, and we build on that. So as you can see, we are able to build on that and up to when we learn about hygiene promotion. And under hygiene promotion, we look at a lot of successful WASH projects. When it comes to certification, so you will be issued with digital certification from HPAS. So HPAS is a global organization that accredits other organizations such as Humanitarian Global, which offers trainings in the humanitarian development and aid sections. So what this does for you is it increases your marketability, it increases your visibility when it comes to recruiters in terms of the specific skills that you do have in the different areas when it comes to humanitarian development and aid work. So for instance, here you will have a certificate as a WASH expert or specialist, and even the certificate does indicate all the modules. These are the modules that I'm currently scrolling through that you will be able to learn. The other course I'd like to talk about today is SBCC, so social social and behavior change communication. So remember, as humanitarians, as people working in the humanitarian sector, you're actually required to have communication skills. And nowadays, it's not just communication skills, but skills that influence the norms, the attitudes, the behaviors of the society as well. So that is what you're going to be able to learn while undertaking social and behavior change communication training. Just to mention the date, from the 9th to 11th of October, that is the physical training. And this will happen at the Humanitarian Global Training Center here in Nairobi. And there's the online one, which is from the 16th to the 20th of October. Remember, I did mention it's on first come, first served basis, where we usually take a number of about 10 participants. So I actually encourage you to register today for these courses. And even as you register, if in case you're having difficulties registering, we will be sharing these links in the chat section. You can just share with us your name, your phone number, and your email address, and we'll be able to assist you. We'll be able to assist you in terms of registration. So some of the objectives that you can expect, or some of the things you can expect while undertaking this course, is an understanding of key concepts, key factors, the strategies, as well as the principles when it comes to SBCC. Remember, I did mention this is a very comprehensive training on SBCC, and you will be able to not only prepare your own communication strategy, but as well as implement it, monitor it, and evaluate it. So you'll be able to create, as you undertake this course, create an entire communication strategy or creative brief, and beyond that, you'll be able to not only see how it's implemented, but also how to monitor, evaluate, and report on the same. So I encourage you all to register for these courses. For you to register, you simply come and click on registration here. And once you've clicked on registration, you will get, it will direct you to a page with a form such as what you can see on the screen. Kindly fill in your details. And when it comes to the training workshop program, ensure you fill, for instance, if it's WASH, I'll fill in WASH, and then I'll be able to fill in whether I want it online or on-site, okay? So for instance, if I want it online, and then I fill in online, and I submit my form, and one of our team members will be able to reach out to you as soon as possible to assist you with the final processes of registration. With that, I don't want to take any more of your time, but I do encourage you, we will be sharing these links, like I did mention, in the chat section. I encourage you to click on them, explore these trainings, as well as register for these trainings. In case if you're not able to do that right now, you can share with us your contact details and we'll be able to assist you. With that said, I'd like to bring on Susan, who will be talking about effective communication strategies for successful SBCC campaigns in the humanitarian context. Sorry, Susan, the floor is yours.
Thank you very much, Diana. And to the rest of us who are listening in, welcome. I will take us through the effective communication strategies for successful social and behavior change communication campaign, specifically in the humanitarian context. And when you talk about the humanitarian context, we are really talking about situations where there's an emergency that has occurred, and we are responding, from our various organizations in various capacities. And something to note is that communication is a very important, issue, especially when you're responding to a disaster or an emergency, because there's a lot of information that is flowing within the organization to external partners, to the community that has been affected, to the host community, if there's any displacement and so on and so forth. So basically, we cannot claim to have effectively responded to an emergency or a disaster if our communication is wanting. And so we will talk briefly about this. Bear in mind, just basing off and building on what Diana has mentioned, that communication strategy is part and parcel of the SBCC course, the Social and Behavior Change Communication course, the communication course that is offered by Humanitarian Global. So this might not be exhaustive because it's a very heavy topic that takes us through a number of days during the course. Therefore, there might be some things I will mention, others I might not mention, and therefore it's very beneficial for you if you are able to take up this course if you haven't already, because then more information will be shared during the course, and it will help to clear up any questions or concerns that you might have. So just going straight into it. SBCC interventions by principle are the same. But communication will be a bit different in the normal context. And in the normal context, I mean, in the day-to-day work where we are going out to the field, we are meeting with communities, we are mostly involved with developmental activities. In the humanitarian context, you see that there will be some bit of difference in how we share information, or how we have the flow of information as we deal with the situation on the ground. So during emergencies, it's very imperative for us to act quickly to bring the outbreak or the disaster under control. Please remember that the main goal here normally is to minimize the loss of life in the humanitarian context. Therefore, we need to act quickly. Preparatory activities may be taken if it is a situation that can be predicted, and therefore there will be a lot of knowledge management that is undertaken from previous events, similar events, that can guide how we will react or how we will prepare well for the event that has been predicted. In the humanitarian context, normally there's very little time to prepare and execute activities, which are generally built on stakeholder collaboration and guided by rapid needs assessments. Ideally, preparatory activities such as setting up coordination systems and social mobilizer networks, or even just identifying important epidemiological and social information should already be in place as part of the preparedness plan to inform a rapid response. Okay. Continuous monitoring is also very integral, in SBCC, whether it is in the normal or in the emergency context. This needs to be done more frequently to assess the situation and how it is evolving, because it will evolve through the phases, and you will see, which phases we are talking about when it comes to an emergency. Therefore, monitoring is quite important so that we are able to tell, what is happening on the ground, how we should formulate our communication strategies to speak to what is happening on the ground, how we can encourage the community that we are working within to maybe continue with the good behavior or take up good behavior, which is basically the goal of social and behavior change communication, to encourage individuals to take up good behavior where there seems to be lack of such. It is also very important to note that emergency communication strategies tend to cover shorter timeframes, and therefore that is why we need to keep reviewing and monitoring very regularly, just dependent on the prevailing situation on the ground. So as part of the SBCC course, we normally go through what we call the C planning process. And the C planning process is basically the 5 steps that one needs to undertake in the normal context to plan for a very effective social and behavior change communication. So the first step is understanding the situation. The second is focusing and designing. So once you've done a context analysis as part of the first step, you now take that information and you're able to build on the problem that you have uncovered in the first step, and therefore start focusing and designing your social and behavior change communication to address the problem that has been identified. After you focus and design your SBCC campaign, then you go into the third step, which is creating the materials that you will need to address the problem that has already been identified. And after you have finished with creating the materials, whether it is posters or flyers or focus group discussions and so on and so forth, then you go into the implementation bit and the monitoring. So this is now where, you know, what you have been putting on paper comes to life. You're now on the ground because you've set the roadmap. So step 1 to 3, you're basically just drawing the roadmap for your SBCC campaign. Step 4 is when you actually implement that roadmap for your social and behavior change communication campaign. And then step 5, you come and, you know, after you have implemented and you, carried out the activities involved with the social and behavior change campaign, you sit back as a team and evaluate how effective the social and behavior change communication campaign was, what can, be improved on, what were the successes, and therefore undertake some bit of replanning if it is in the normal context where you maybe have a 5-year program. If it is in the emergency context, then the replanning would be, would happen as we move from one phase to the next phase of the emergency. So why social and behavior change communication in emergencies? We have various reasons. During disease outbreaks and emergencies, specific actions are required of affected communities for prevention, containment, and control. If, for example, we're talking about diseases. So communities need to be informed, they need to be motivated, they need to be equipped to practice and the necessary protective behaviors. And this can be achieved through an effective social and behavior change program. So the SBCC program plays a critical role in addressing all the behavioral and social aspects of disease prevention and control. In small groups, you come together and you want to discuss in the communities and find out what is happening, what are the issues when it comes to behavior that could be affecting the behavior that is being, noticed at the moment or noted at the moment, and what can be done, to correct that behavior and encourage uptake of good behavior. So SBCC will provide accurate, clear, relevant, and timely information to the public. It will identify and address myths and misconceptions that may lead to detrimental practices. SBCC will also enhance and maintain public trust, especially in the situation where the public doesn't really understand what is going on. They don't have information, and therefore there's a lot of rumors that are, going around, swirling. For example, COVID-19, when it first broke, there were a lot of rumors that were going around. People didn't understand, what was happening and how we could, stay safe. And therefore, social and behavior change communication campaigns were rolled out to give more information to the public on what is going on, what needs to be done by the public to keep themselves safe. So there were a number of steps that, we were told to stay away from crowds, we were told to wear masks, we were told to wash our hands, those are the call to actions. We were told, how the COVID-19 virus affects us, affects our bodies, who is most prone or vulnerable to that virus, and so on and so forth. So by doing so, we were building on that trust that we have with the public. SBCC also prepares communities for emergency response actions, again, through the call to actions. It reassures the public because, where there's no reassurance, there'll be a lot of panic. Then, the detrimental practices will take full effect, and sometimes it's very hard to reverse that once it has happened. And SBCC finally can support communities and countries to recover and rebuild themselves after an emergency. It doesn't have to be a health emergency, could be, for example, an earthquake. So through social and behavior change communication, you're able to continue encouraging the communities to take up action to rebuild their homes, to give more information to the authorities, where maybe there's some water supply, for example, that is cut off, or there's some services that they are able to access, and so on and so forth. So the key areas in which SBCC comes into play would be, number one, coordination, and this is coordination internally in the organization and externally to partners that are also responding to the same emergency as you are. Community mobilization and action, again, very important, because you're not able to do the actual behavior, and therefore you would need to mobilize a number of community members to come up and to encourage the rest of the community. For example, if it's to build latrines for internally displaced people, there'll be a lot of mobilization, because you also want them to take ownership of the facilities that have been provided for within the camp. Then there's message development and dissemination. Very vital, and that is what you're going to be, talking about today. Capacity development. You find that for emergencies, you will need to bring on people from the community that you will need to enhance their capacity development in terms of SBCC, where they might not have been exposed to such in the past. And then there's monitoring and evaluation. As I had earlier highlighted. If an emergency response does not include strategically applied communication activities, you need to know that it's unlikely to succeed. And this can be demonstrated by the Ebola virus that hit West Africa in 2014, when lack of adequate and appropriate communication early on in the response fueled fear, panic, and denial. There was a lot of misconceptions that were spread and rumors, and this contributed to the further spread of the disease. Therefore, SBCC has been acknowledged as a key element of any crisis or emergency preparedness plan, and should be integrated in all stages of an emergency response, from prevention and preparedness through to crisis response and recovery, okay? So at the beginning of an emergency, the role of social behavior change and communication is to engage the public, to support them in making informed decisions about the risks exposed to them, and encourage them to respond effectively to those risks. The communication and the related pillars will ensure that response activities are accompanied by appropriate communication interventions. So when you come to communication strategies, this is the second step of the C planning process, which is focusing and designing. And this is where we develop a document referred to as a communication strategy document that allows programs, SBCC programs, to focus on specific audiences. The reason why we would develop this document is it provides direction and ensures that the materials that will be created all work together to support a clear vision. So it is a roadmap. It guides the decisions and ensures that the plan is implemented according to the decisions that have been made. So before you go into the implementation bit, you're putting in the steps that need to be done. You're putting in, you're giving responsibilities, who's going to do what, how they're going to do it. What are the goals, what are the objectives of the SBCC campaign, and what the message looks like, okay? Then finally, it encourages action, builds consensus, promotes community participation, resolves conflict, and also elicits input from all involved. The point in which you would be developing the communication strategy document would be after conducting a situational or context analysis, which is a first step, and before implementing the SBCC program. So it is a vital step that you cannot afford to skip. The reason why the communication strategy document presents an overarching approach to designing activities, materials, and products. It also pinpoints potential communication strategies and channels for communicating information for a specific purpose, and it specifies strategy feedback mechanisms, okay? So communication strategy documents may take different formats, but normally the information contained in them is more or less the same. Especially, if you have been involved in any communication campaigns, you will note that at some point, a communication strategy document was developed. So the format may differ from organization to organization depending on what is meant to be, put on paper, but you find that the information, just maybe English is different, or depending on the language that has been used, the wording could be different, but the information put in the strategy document or captured in the strategy document is the same. So as mentioned, the strategy document will guide how the SBCC program is going to be implemented. It can be reviewed to see if new ideas are in line with the strategy. So the strategy is not rigid, it's flexible. It allows you to make changes as you continue refining your roadmap for the SBCC implementation. If resources are tight, the strategy can determine priorities for funding, because now it will show you clearly on paper what is important, what needs to be done first before the next step or next activity is implemented, and so on and so forth. And therefore, it will help you prioritize. If there are any unexpected challenges, coming up, the strategy can be consulted, during implementation to determine, if these events affect the way forward, and if so, then what do we need to do? How can we incorporate them in the strategy document as we continue the implementation to ensure they are well taken care of? So therefore, the strategy document should not limit the program's ability to shift direction. At the same time, the document will help managers be mindful of the approach that is being taken, okay? So when you're talking about communication strategies in an emergency, the SBCC would basically focus on the identification of mitigation measures at the individual, the community, and societal levels. There will be preparatory design of communication and policy interventions. Remember, or rather I should mention at this point that social and behavior change communication campaigns should be theory-driven and evidence-based, and should be contextualized as much as possible. By this, I mean that we're not going to employ guesswork. Doesn't matter if you have been working in that area before the emergency hit, or maybe you were born and brought up in that area. There has to be research that is being conducted. There has to be an analysis of the situation as is, and this is what we use to back our activities or interventions in the emergency context. And the SBCC will promote social and behavior approaches to reduce risk and impact of the health emergency. So when you're talking about emergencies, we're talking about 5 different phases of the emergency: the pre-crisis, the initial phase, the maintenance phase, the resolution, and the evaluation phase. So going into the pre-crisis phase, this is the stage in which we may anticipate some disasters, and therefore some preparation can be done in advance to be able to take that into account. Some locations, for example, could be prone to flooding, landslides, and so on and so forth. And therefore, we are already able to anticipate if there's a heavy event of rainfall coming up, you can anticipate that there could be some flooding, there could be some landslides, and therefore already begin strategizing for this communication. And once we've put it on a strategy document, we can already start sending out this information to just give an early warning system or signal to those who are living in that area. So for this phase, the activities that could be employed include mapping of partners and stakeholders, mobilization and communication coordination mechanisms at the social level, increasing or creating trust where there isn't any collection of data to produce a summary of key household behaviors and practices. If the area is prone to disasters, then we're talking about preparing culturally and contextually appropriate key messages that can be quickly disseminated to that community. Here is where we'll also be developing the communication protocols and the action plan. So we still have time because the emergency or the disaster hasn't hit. Therefore, we are able to put up the plans in good time. We are also able to set up an emergency helpline, including location, protocol, and staffing structure. So that is the pre-crisis. When we go into the initial phase of the emergency, we are then confirming that it is happening. At this phase, there's bound to be a lot of anxiety, bound to be a lot of rumors going around, spread within the communities, and if not properly addressed, this could be, detrimental to the SBCC campaign, because then this is the stage in which unhealthy practices might be picked up. Activities included with communication needs include, selection of a spokesman or spokeswoman to be gender cognizant to confirm that the outbreak or the emergency has happened, and this should be through appropriate channels. We'd also be mobilizing partners, leaders, social mobilizers, and stakeholders, even amongst the media, to disseminate information as quickly as possible. You would activate feedback loops and two-way communication mechanisms between the national and local coordination systems and communities. Rapid assessments, needs assessment would be undertaken to determine key barriers and inform messages that will be developed. Key barriers here, I'm referring to what are these things that are stopping the audience that you're speaking to from practicing that good behavior. So those are the barriers that would need to be addressed in your social and behavior change communication campaign. There, at this point, at this phase, the initial phase, there will be the development of key messages to provide accurate information. This is very important because the audience can always tell if you are lying. If you're going to, spread false information or half-baked information, the audience will be able to pick that out, and this will further just, push them into adopting unhealthy behaviors. The SBCC strategy would then be developed and implementation would begin. At the same time, monitoring would also begin. So once you are done with the initial phase, we would go into the maintenance phase of the emergency. And here, the emergency is stabilizing, or it is progressing at a very slow rate, slower than the initial phase. There still is bound to be some flare-ups or aggravations, especially because as you encourage the communities to adopt good behaviors, there could be some complacency or be discouraged because it seems to them maybe there's no end to this event. Therefore, feedback from stakeholders and communities is very essential to inform communication activities and messages that are in line with what is happening now, so that they respond to the barriers that may have shifted from the initial phase to the maintenance phase. Again, the activities included here are, development of communication plans with stakeholders to recommend how best to move forward on the risks that have been uncovered. More information from social mobilizers, spokespeople, and audiences should be shared to the community to detect new behaviors, and more information should also be coming back to the organization so that we're able to counter these new behaviors and rumors. There's adjustment and review of the key messages to respond to the needs that may have changed from the last phase to the maintenance phase. And then the reinforcement of positive behaviors that have been adopted, because at this point you're hoping that, for example, if it's COVID-19 and you ask people to wash their hands or sanitize, then that has been noted that people are actually washing their hands, they're actually moving around with sanitizers. Therefore, you need to encourage that good behavior. So moving from the maintenance phase to the resolution phase, at this phase, your emergency or disaster is more or less under control. The progression has slowed down, and therefore communication is key to ensure that members of the affected communities do not become complacent, thinking that the risk has gone and we are now no longer prone to COVID-19. Just as an example, the activities included here are number one, reinforcing the positive behaviors and continue to highlight the risk that is still existing amongst us. There will be a process evaluation that is conducted to assess the effects of the SBCC activities and use this information to review the approach if necessary. There will be a continued liaison with social mobilizers, with partners to gather information about how communication activities are being received and if there's any new factors that need to be addressed. There would be development of campaigns to promote understanding of the need for new desired behaviors to end the current emergency and prevent future ones. So for example, with COVID-19, there was still was a sustained message of, washing hands and just observing general hand hygiene, because it's beneficial for us, not just in combating COVID-19, but also other fecal oral diseases such as diarrhea and cholera. Then, psychosocial support needs might be needed at this phase. This is because, going through a pandemic, going through an outbreak, going through an event such as an earthquake or post-election violence can be traumatic, and therefore psychosocial support would be part of the services that would be offered to the survivors. And, in case there's any mistrust that could be going on, then that is the point in which it also be addressing these issues to ensure that the good behavior is sustained even past the emergency response. So after the resolution phase, we go into the evaluation phase. So this indicates that the emergency has now come to an end, and it now gives us an opportunity as responders to review carefully how the communication strategy was implemented during the emergency. It is important to identify successes and lessons learned to shape future preparedness and response. Some of the activities included here are examining and recording promising practices, successes, and lessons learned from all partners that were involved in the response. Sharing findings is also very important, and the findings should also be shared to the community. This is because it sheds more light on what exactly happened, how the event was responded to, and in future, if such an event is to occur, these are the steps we would take based off on the learnings that we have from this event that has just come to an end. Recommendations and changes would be implemented and made to address issues more effectively in the future, and recovery plans would also be developed, working with stakeholders to coordinate communication efforts related to recovery and system strengthening. So at this phase, we'd also be conducting a lot of evaluation. As you can see on the image on the screen, monitoring began the minute we started implementing the SBCC campaign, but evaluation would be done at discrete points, and that is at the baseline when we start implementing the activities, when we set our targets and indicators, and at the midline, midpoint of implementing of our activities to find out or to see if you're being effective, if there's something we need to change with how we are going about with implementing our activities, or if you're moving in the right direction. And then at the end of our SBCC implementation phase, where we're now evaluating, or we are looking at what has been done, what has been implemented on the ground, what are the successes, what are the points that we have learned, and moving forward, what do we need to do differently. So measuring advocacy and social mobilization activities is similar to that of other programs, that have been implemented or you have been part of implementing. So it's not quite different. It's maybe that the indicators and the targets would be different in terms of how you measure an SBCC program as compared to the mainstream big programs. So once you have that data that you have collected through monitoring and evaluation, you're able to then replan if there's a prediction that this event could occur in the future, and just to inform responses in the future, whether or not that event is going to occur. So replanning is about asking questions to determine what the data means. Once an issue is identified, one of the first steps is to ask why it is an issue, and this can be done or investigated through small discussion groups or questionnaires that stakeholders and implementers can fill in. And once us as practitioners are able to figure out why things are happening, then we can start to replan. So on the screen, you can see what you can use the monitoring data for, and what the evaluation data can be used for. Once all this data has been collected, then we move to reporting. SBCC reporting, I will acknowledge that it can be a bit difficult, especially because of the number and variety of activities that have been implemented, the potential increase in the number of stakeholders or donors to report to, and the likely differences in their reporting requirements. I would advise that, you start, just before you start with a program or SBCC implementation, it is important to sit down with the multiple stakeholders and donors and get to understand, what it is that they require as part of reporting, what they can negotiate on and what is non-negotiable, and together draft up a reporting template that is acceptable to all. This will reduce the instances of reporting, of producing several reports, all saying the same thing, just in different wording to different donors. This will be, it can be time consuming and therefore and resource consuming, because then it means a lot more people would be involved with the reporting. Whereas if it is just one template and it's quite clear on the information that is required, then you can go ahead and just fill the template and submit to the number of donors that are come into play. So in summary, this is how communication or hygiene promotion in emergencies plays out. We have a lot of community and individual action, communication with WASH stakeholders, responding to that disaster emergency, distribution of items, community participation, use and maintenance of facilities, and a lot of monitoring. So that is just to give us a quick overview, because we also don't have so much time, but it gives us a quick overview of how we would go about establishing a communication strategy in the humanitarian context, bearing in mind how to rope in the various stakeholders that are involved to ensure that we have an effective social and behavior change campaign. So with that, I want to say thank you very much for listening in. I'd like to hand the session back to Diana, maybe to take us through any questions or comments that may have been shared while I was making the presentation. Thank you very much.
Thank you very much, Susan, for that. And thank you to our attendees for following through. And for those of us also who've been asking questions, thank you. Attendees, at this point, we've come to the Q&A bit of our webinar. And I'd like to welcome those of us who have questions. Either you can raise your hand, will allow you to speak, or you can put the question in the Q&A section, and I'll be able to read that out. So let me start by, excuse me, by reading Dominic's question, Dominic's comment slash question. So Dominic says, thank you for the presentation. SBCC campaigns seem to be resource intensive. Can the resources be limited and still be effective? So can we have an effective SBCC campaign with a limited budget or limited resources? Susan, you can take that up.
Thank you, Dominic, for that, and for Diana for reading that. Yes, your SBCC campaign can still be effective. Why? Because with the resources that are available, you'll be able to prioritize the activities that need to be done for you to realize effectiveness or impact. This will, of course, be determined by the theory of change that the program has. And therefore, you are now able to, assign resources, in a manner that allows you to still realize an impact. It might not be at a grand scale, but you will still realize impact. Again, the communication strategy document comes in very handy when it comes to resource allocation. Because this is a stage in which you do resource allocation and planning. So it's still something that is doable. And yes, I agree that SBCC is resource intensive, but still, a lot can be done even with that lean team that, it might appear that it's a small team, or, the funding is quite limited, but that doesn't mean that your effectiveness is limited to that. And a good thing would be also to plug into or look for partnerships with organizations that are implementing similar, if not the same, sort of program within the area you're working with. So I encourage highly, if it is something that is possible, you can sit down with this organization and see what you're able to offer and what they're able to offer, and complement each other's efforts to realize even bigger impact. So partnerships are quite key, especially where we have limited resources. Thank you, Dana.
Thank you so much, Susan, for that answer. And you did mention communication strategy. It's good that you mentioned it, because Cosmas kindly asks, can you briefly show us a sample of communication strategy you already have? So I know it might take time for you to go through your computer and be able to display that. So in the meantime, I can move to the next question. So Sheila asks, what are some of the SBCC impact indicators in the humanitarian sector?
Thank you, Sheila. I might not give you a specific indicator, because this indicators and targets are normally program specific. This is something you, as part of the organization, would develop with the donor if it is a co-creation process. But basically, the indicators would be those numbers that allow you to assess whether you are actually moving in the right direction as compared to the program goal or the communication objectives that have been set. So the indicators need to be specific, they need to be measurable, so as to help you plan or track the effectiveness of the program. It could be, percentage number of people that are now practicing hand hygiene as part of your, indicators. So it's very program specific. I might not be able to give you one, impact as such, unless we are now able to go through either a dummy program or a program you're working on to see, what you can set as your targets and indicators. to better assess your SBCC program. But your indicators and targets, just the way you developed, you would go about developing your monitoring and evaluation framework is the same way you would tackle your SBCC program M&E framework, by just setting up those indicators and targets at the very beginning and monitoring those and evaluating them at the very end. Thank you. I hope that answers that question.
Thank you so much. And in line with actually the indicators, when it comes to impact indicators in SBCC, Ruth has a question and asks, what is the best approach for an effective SBCC, especially within the rural communities?
The best approach would be first, doing a context analysis. Rural areas, it would be easy for us to just group and say, well, rural areas are the same, but really the context of a certain area might differ even if they are both classified as rural. So it is very important for you to do a situational and context analysis for that specific rural setting, for you to determine what exactly the problem is. And I want to point out at this point that there's no one-fit-all SBCC template or campaign. No. SBCC campaigns are very context specific. You might have a general framework, or just this, for example, the steps that I've gone through, just telling you, this is the step that you need to follow when you're formulating or developing an SBCC campaign. But there's a lot of contextual issues that need to be plugged in to flesh up that framework, and that can only be done if you conduct a contextual analysis to really understand what the problem is, what the underlying issues are, what are the direct causes of that problem, the indirect causes of that problem, and the overall effects of that problem within that community. So contextual analysis, very important. Thank you.
Thank you so much. And I do apologize to our participants. We are 2 minutes beyond time, and the questions are so many, especially on SBCC campaigns, how they're going to be conducted, in terms of implementation of these SBCC campaigns and the budgeting. There are quite many. And these questions, actually, we will take them up and answer them in our community forum. We do have a community forum where we are able to discuss all this, and we will be able to take those questions up. So as I read my next question, I'll ask Mohammed to prepare himself with the question. He's going to speak right after this. So the next question I'm going to read is from Ernest. Ernest says, the pandemic is unpredictable. How the SBCC can be planned without knowing the kind of pandemic, area of intervention, and the budget required to implement the SBCC plan. So how do you go about this, knowing that pandemics are actually not just pandemics, but any disaster is quite unpredictable. You never really know when it's going to occur. So how do you go about planning for SBCC campaigns, especially when there's a budget, there's an implementation plan required?
Thank you. So Ernest, I will answer this in 2 ways or 2 scenarios. The first scenario is you work for a humanitarian organization and your core mandate is to step in where there is, a life-threatening event, emergency or disaster. You will find more often than not that there is some budget allocated to respond to an event that maybe, might take the country or that community by shock. Could be small, and therefore that is why you find that a lot of the organizations would then ask for donations from other organizations or from well-wishers and set up an account where people can, send in their donations as they please. So that is a scenario where you work in the humanitarian sector, you have a small budget, but you're still able to plug into resources from others. The second is And then the second, the first is already you're able to predict. I think that's the first one. The first one is that you work in a humanitarian organization. Some of the events are you're able to predict. For example, flooding, landslides, because it's a seasonal issue, you're able to predict, and therefore you set aside a fund to tackle that. In the scenario where you are able to predict, then you would be plugging into the various partners, organizations, donors, well-wishers that are able to donate to the cause that you are working through, or the event that you're responding to. Partnerships are very important. You might find that you don't need to, and anyway, most often than not, and you can correct me, one organization is not able to tackle everything that pertains to responding to an emergency. Therefore, it's always very important to prioritize what your mandate is as an organization in that event or in that emergency, what you're able to do with the resources available. If there are no resources available, where can you tap in to support, or where can you tap in to gain that support to enable you to carry out your mandate? So those are some of the scenarios that come into play. I hope that answers your question.
Thank you so much, Susan, for that. Like I did mention, we have a few participants who would like to ask questions. We'll start with Mohammed, and Mohammed will be followed by Tina. Mohammed, if you can hear us. Okay, Tina.
Good morning.
Good morning, Tina.
From the UK. I just listened to the aspects of mentioned Ebola and the communication and behavioral strategy, because I just wanted to add that mostly the central communication, health communication, we have the exact messaging to ensure that there are no mixed messaging. And in relation to dissemination, obviously they'll have consortiums or essential pot wherein partners can you have bigger partners who've got other IPs that they can share resources. So I just wanted to add that.
Diana?
Thank you. Thank you so much, Tina, for that. Back to the questions. We do have other participants as well who'd like to ask questions. We do have Abdirahim. Abdirahim, if you can hear us as well. Abdirahim, are you able to hear us?
Yes, I think so. You hear me well.
Yes, we do.
Okay, great for this session you did for the presentation. Thanks for your wonderful presentation. I would have to like to share I participated for different meetings such in you have shared from my email. Thank you for that awareness always you did. So I like it to get some certificate such, for the training, emphasize it. So could I able to get for those, certificates? I'm in Somalia, me, Abdullah. Thank you, Diana, and other participation for the session you did, SBCC. Always, thank you very much.
You're most welcome. And participants for these free webinars, we do not issue certificates for the free webinars. However, if you join any of our paid trainings, could be on WASH, could be on SBCC. Like I did mention at the beginning of this webinar, that we do issue you with digital certification for the paid courses. However, for the free webinars, we do not have the certificates, although we do share with you the presentations that we did make, such as what Susan was able to present today, as well as the recordings for the webinars. We are able to share with you that. Susan, there was a question. I don't know if you've been able to get from Cosmas. There was the question of, can you briefly show us a sample of communication strategy if you have one? I don't know if you've been able to get one. If not, we will be able to reach out to Cosmas and share with him one and as an example, or via email. We will share with you when we're sending the recordings as well. We'll be able to share with you that. Susan, have you been able to get one that you can briefly show us?
I would advise that I could share a template on email, but the best would be that for more in-depth understanding, we join us for the classes, because then we go through the document more in-depth. Information is shared. Just so that we understand why the document is sectioned the way it is, what information goes into that document, to just make sure that we are all on the same page. But our templates can be shared on mail. Right now, going through it might be, it's a whole lesson on its own. So right now, sharing it might not be best, especially because we're already even over time allocated for this. Diana?
Thank you so much, Susan. And as you've heard, Cosmas, the best thing to do is to join our SBCC trainings, because like I did mention, not only do you get to learn about the principles, strategies of SBCC, but you're able to create a communication strategy on your own. You're able to effectively create, starting from the problem statement, understanding the situation, as well as people context analysis, the different type of audience segmentations, all the way to the implementation, as well as monitoring and evaluation of these communication strategies. So if you do join our class, you'll be able not only to see all these case studies, all these examples, but also be able to effectively prepare one on your own. And with that, participants said, I see we are 12 minutes beyond time, and I do apologize for taking up 12 minutes of your time. At this point, I'd like to say thank you so much to all the attendees, especially those of us who've been quite engaging in the chat section, in the Q&A section, those of us who've even taken up initiative to register for the upcoming SBCC and WASH trainings. Thank you so much. For those of us who've even shared their details, our team will be able to reach out to you in the course of the day. Thank you so much to Susan, our WASH/SBCC expert for the day, for sharing her knowledge with us. Like I did mention, we will be sharing the recording as well as the presentation. By tomorrow close of business, we'll be able to have done that. So thank you so much, Susan. Thank you to the entire Humanitarian Global team working behind the scenes to ensure that this webinar runs smoothly. Like I did mention, it's also live streamed on Facebook as well. So thank you for those of us joining us from Facebook as well. With this said, I do bid you farewell and hope we'll meet again next week on Wednesday, same time for another webinar. With that, I wish you a great rest of your day. Goodbye.
Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition and emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.